So hi Vitalabers and YouTubers. So what I'm going to speak to you about is basically a continuation on genetic testing, and we just released a video to talk about why it's advantageous, but the question really is, how many embryos should I biopsy? And very often this boils down to a financial decision for many couples. What you need to understand is that to biopsy an embryo requires that the lab takes a small sample from that embryo. The embryo is then frozen. That small genetic sample is sent away to an outside genetics company who amplifies the DNA and then runs a genetic test on that DNA. And we receive the result about 10 days later. That process costs roughly 7,000 Rand per embryo that you're testing. And so really, it boils down to how many embryos you have available to you and what your budget is for testing. You don't have to test all of the embryos that are available. In fact, you can instruct our laboratory to test 1, 2, or any number of embryos that you choose to test, and they will test them in order of their potential. In other words, they will choose the best potential embryo based on grade and start biopsying from the best to the worst. So if you say to them, I've got 8 embryos, but I only want to test 4, then that's fine. They will test the best 4, and the other 4 they will freeze without testing, which obviously is associated with a much lower cost. So you can tailor your IVF program based on your budget. You should not feel pressured into testing a particular number of embryos. You can discuss this obviously with your treating physician or your treating doctor beforehand and say, what do you think is a reasonable number of embryos to test for my age or my particular condition? And then also balance that with the budget that you've set aside for this process, so that beforehand, before the lab calls you and informs you how many embryos are available, you need to have worked out, well, if it's 7,000 Rand an embryo, I'm prepared to biopsy, let's say 4, but I'm not prepared to biopsy more than that based on my budget. And that could be a different number for any different couple. I don't think 4 is a magic number for everyone. I'm just using it as an example. But I want you to be aware of 1, what the cost is per embryo biopsied. 2, what the advantages are, and that's covered in a different video. 3, that there are options of choosing not to biopsy embryos, or you can choose to have them biopsy the embryos, but not run the genetic tests. In other words, they amplify the DNA and they keep it for you. And in the future, they can run that test. So you only pay for the test in the future if you choose to use those embryos in the future. So there are various ways in which you can choose to come out on your budget and still test some of your embryos. I hope this has been informative. If you have any questions as to how many embryos you think you should biopsy and what the cost is, you can discuss it either with your coordinator, your treating doctor, or the accounts department. Thanks.